Hi, I'm Sarah O'Callaghan. I'm a psychotherapist working with birth trauma. So what are some signs that a parent might need to seek EMDR therapy for birth-related trauma? Following a birth, it's quite normal to experience tearfulness and mood fluctuations. This is due to the huge shift that takes place biologically and psychologically in becoming a mum to a newborn and the feeling of exhaustion that starts to set in during the weeks following the birth. Birth trauma is often overlooked or not well understood by some families and medical professionals. Often GPs can be quick to diagnose postnatal depression rather than birth trauma, and certainly there are some symptoms that overlap between the two. If someone has suggested to you that you might be depressed following the birth of a baby, considering the experience you had at birth is particularly important when differentiating between depression and trauma. Some signs that someone might need to seek therapy for birth trauma include experiencing intense anxiety that is fairly consistent and isn't relieved by moments of joy. Anxiety is persistent and pervasive, restricting how much a parent is able to enjoy the early weeks and months of parenthood. Anxiety can be heightened when thinking about the birth or having to visit hospital or anything that triggers the memory of the birth. One of the major symptoms of birth trauma is experiencing vivid memories, flashbacks or nightmares that are unpredictable and come without warning. These can be particularly distressing if you experience these as though you are back in the moment rather than seeing this as a memory. This can lead to overwhelming fear and panic and generally a feeling of being unsafe. In some cases, a person who has experienced a very difficult birth might have thought that their baby was going to die, and so flashbacks are the brain's way of trying to make sense of such an unexpected event. If you've had a birth trauma, you might find that you avoid thinking about the birth or avoid visiting anything that triggers thinking about the memory. It's perfectly valid why someone might want to do this. However, longer-term avoidance can be problematic and maintain your difficulties. You might also find that you dissociate from the world around you in disconnecting from your thoughts, feelings, or memories. Sometimes this can feel like daydreaming, but in more severe cases, you can feel a sense of depersonalization, as if you are watching your life from the outside. Parts of your traumatic memory may also be unclear or disjointed. You may also find that you are fixated on what happened and ruminate or replay moments of the birth over and over to try and make sense of what happened. And this can be particularly troublesome if you associate this with critical thoughts about yourself, such as, "I should have done something different," or "my body failed me." EMDR can be a suitable option for birth trauma when it feels very difficult to talk in detail about what happened. Unlike trauma-focused CBT, there is no reliving of the trauma memory in the present tense, and in some cases, it is possible to do EMDR without the need to disclose to the therapist any details of the memory at all. Hi, my name is Sarah O'Callaghan. I'm a psychotherapist with almost 20 years' experience of working in the NHS and private practice. You can find me on Instagram at The Motherhood Therapy or on my website, themotherhoodtherapy.com. I've just spent the day filming with MindFriend. Check them out for more content.